Hi there, my name is Alyssa and I oversee patient care at Options Naturopathic Clinic. And today I'm here with two of our doctors, Dr. Aaron and Dr. Patrick. And in this video, we're going to talk a little bit about our cancer care. Since we are a metabolic terrain-centric clinic, can you kind of explain a little bit what that means and who Dr. Nasha Winters is and a little bit about her metabolic approach to cancer?
So first, after diving deep into natural medicine and just really kind of geeking out for several decades, started looking at natural medicine when I was 16, 17 years old. And then, after like 15, 16, 17 years of practice, there was still some things that I can't say I had like really figured out. And I found Nasha Winters, and she had been on her own journey in natural medicine, naturopathic medicine, having been diagnosed with terminal stage 4 ovarian cancer just after her 20th birthday. And I was really kind of blown away at how much her thinking aligned with my own in terms of the therapeutic philosophy, but also what she had figured out in relationship to how to use different conventional lab tests and having a really clear process when it comes to addressing people who have had cancer, because she figured that out. So Dr. Nasha really gave us the clarity of where to go and what to do next, kind of really sharpening that therapeutic order of how to proceed with a particular person's journey to help them succeed.
And when part of that is looking at what we call the metabolic approach to cancer. And the metabolic approach to cancer, in short, is looking at, how the body utilizes nutrients and gets rid of waste products. And looking at, that what we call the terrain, what we have, we've talked about before, and really addressing that, versus the conventional approach is looking at what we call like the somatic theory, or kind of the DNA mutation, where there's really not much you can do. It's taking the power away from the patient of, you just ended up with this, where we know that, the research is showing that, 5 to 10% of cancers, only that amount has a genetic component. But even that, our genes we're discovering are influenced and modulated by all the terrains and the things that we're doing with it.
Yeah. So this idea of taking the power away from the patient, this notion of it's just random and there's nothing you can do about it. I mean, I think random really just means that you don't understand the what and the why of a person's diagnosis with cancer.
Yeah.
And conventionally speaking, the therapies and things that they have kind of either they're cutting it out, they're doing, radiation, or they're poisoning it. And they're forgetting that you're actually kind of damaging and killing your own self, your own body in the process.
The cancer is part of you. It is you that's shifted. Yeah. And this metabolic terrain approach is knowing that when we correct the terrain, when we correct the metabolism as part of the terrain, meaning how your body burns fuel for energy, then there's an inherent healing process that happens. Whereas when you try to go after specifically the tumor and you either radiate it or surgically cut it out or try to shrink it with chemo, you're essentially maybe removing cobwebs, but the spider's still there. And if the spider's still there, it's just going to build more cobwebs. Yeah. So the metabolic terrain approach is really focusing on removing the root cause, which would be that spider in this analogy.
Yeah. Well, and all of our doctors at Options have been formally trained by Dr. Nasha Winters as well. So that's something else. Her approach specifically, our doctors are very well versed in. And to get a little bit into the process for cancer care, for any prospective patient out there who may be interested in what we do, or maybe a family member you think could benefit from what we do, we really have created a very cohesive, supportive onboarding process for all of our new oncology patients that actually splits it up into 4 separate appointments. The first one is called the GREET, and this is with one of our patient support specialists, just to kind of understand the process to come and a little bit about our approach. The second appointment is called the Gather, and this is with either Dr. Patrick or Dr. Laura to gather all of your information, your medical history, personal history. And then the third appointment is called the Guide, and this is with another one of our metabolic terrain docs. And this is to really obtain all of their suggestions and information after they've really analyze the data. And then the last appointment is called the grasp. And this is with another patient support specialist to really help make sure that you understand all of the suggestions, are ready to implement them, and answer any questions you may have. And we really have seen an increased success with our patients by implementing this new onboarding process. So if it's something you're interested in, or something you want to read a little bit more about, feel free to go over to our website. It's optionsnaturopathic.com.